All right, ladies and gentlemen, Kevin McNicholas, school social worker for the Gillespie School District and one of the founders of Mental Health First Responders. Honored to have all of you here and excited to welcome Adam Hickson this morning. And Adam's going to go first, and then Meaghan Jorgensen after him. We got some great info today from some great presenters. Happy to have everybody here. And Adam, we'll turn over to you.
Yeah. So thank you for having me. I appreciate being here, and you guys do an awesome thing. So this is awesome. So I guess disclaimer ahead of time: I teach full time. So if there's people around, because I'm a PE teacher, and it seems to be everybody's favorite spot to be in the school sometimes. So, but yeah. So my goal today is I'm going to do a shameless plug for myself at JerseyFit Barbell. I'm going to talk about kind of what we do as a gym and how we impact some of the stuff I'm going to talk about. And then I want to get into how we look at health and wellness as a society, and then maybe kind of give some tricks of the trade and some advice for how you can better that for yourself. And then, Kevin, you got that slide handy still? Perfect.
That's up. Okay.
Yeah. Alrighty. So, as I was kind of saying, self care and personal wellness are the main focal points, and I want to give you some strategies to take care of yourself and explore self care a little farther. You can go ahead and click the next one. So here's my plug for me. I own Jersey Fit Barbell, but I don't think that's a glamorous thing for me to say. I think it's a community of people that own Jersey Fit Barbell. We're a big group of people that all have the same mission, and I'm blessed to be a part of such a community. But for the people on the screen, there's myself to the far left there, and then my co-owner to the far right. And the group in the middle is, I'm not saying they're not special, they're amazing, but they're something that we're able to give back to. So they're all wearing shirts that rep Jersey Fit Barbell, and I think that's just a small microcosm of what our bigger goal is. Like I wouldn't be shy to say we want to build strong people that are resilient physically, but we've been blessed to be in the community, and we're very, very powerful connections with people like Kevin that seek things out that are a little bit more outside of the traditional meathead lifting heavy circles. So we're a 24/7 private gym. We're rooted in the 618, and we currently service about 175 amazing members. So if we want to go to the next one, I think the big misunderstanding when I sat down to think about one of the topics I wanted to look into was that the word health is largely misconstrued. I think when people say they want to get healthy, I think people immediately jump to what they look like instead of how they might feel. And it's definitely a facet. I think if you're going to be in the health world, most people maybe have a certain aesthetic, but not always. And that's perfectly fine. So whenever it breaks down, it really fills into three categories. There's physical, mental, and social. And my hope today is to highlight all three of those and then kind of segue into maybe how that can be tied into your life to make sure that you are both healthy and generating some personal wellness to be the best you can be. So if you want to roll down one more time, Kevin. So if we look at physical health first, this is the elephant in the room, for lack of better words. This is the one where I think people think if I'm going to be healthy, I got to be physical. And I think you have to be to some degree, but I think the how for how we get there is interpreted. So let's look at the benefits for health first. Let's make it to where it's cool, right? So the easy ones that I think everybody knows is it lowers the risk of chronic disease. I think as we get older, that stuff becomes way more of a focal point. So when you're young, you're Superman. You're never going to get hurt. You're never going to have issues. Weight's not even a concern. But right now, as most of us are, certain things are kind of creeping into our lives. And sometimes just small steps towards being more physical can help mitigate those, but largely, right? It also promotes healthy weight and physical fitness just in general. And I think manageable weight is probably the best word. I think healthy is a bad term. But I think what the check mark. Can I look in the mirror and do I feel good about myself? There's step one. And then step two, am I able to do the things in life that I want to do? Right. I played football in college. I was blessed to be in that world. That was a different frame. If somebody gave me $1 million to catch a couple snaps right now, I don't know if that's the case. But I enjoy what I do. What I do physically allows me to live the life I live. And I'm happy for that. So the other major benefit is it reduces your stress and anxiety. And I think all of us in this profession have quite a bit of that, right? But I can tell you confidently, every workout, even if there's no such thing as a bad workout, but every workout is going to take a small chip away at that somehow, some way. And then the last thing that I've kind of gotten used to recently is understanding weight as literal weights. I think people watch the scale for the numbers that are on the scale, but we start looking at things like your musculoskeletal strength, your physical activity builds a stronger frame. We need to think of our spine and our body as a living, breathing organ, essentially, and we only get one of them, right? So if we have a little bit of less weight on it, it functions a lot better and we move a lot better. So the body's happy. And ultimately, we live better. That's the goal, right? As people age in life, they try to get more healthy, and it usually is the opposite. You need to be more healthy so you can live better in life. And that's not to get too deep. I don't want to make it a negative thing, but I know a lot of people come to our gym and they want the quality of their life as they get older. Maybe they've got their own kids, grandkids, things of that regard, and they want to be able to get on the floor with them and make sure they're there and available. And I think the biggest thing is priming our bodies so that we're able to do that when we get in that position. And it starts with your physical health. So you can go to the next one, Kevin. Physical health segues into your mental health. Okay. So I think this is a term that is not necessarily wrong. I think this is a term that I think people get wrong because people paint narratives, right? Mental health and emotional health focus on emotional regulation. So your psychological resilience and the ability to manage your stress. I think in education, especially, this is powerful because if you're not mentally stable, then the people you lead aren't going to be mentally stable, right? And for me, I know I'm biased largely, but when I'm in the gym, my mental health is way bettered by a good workout. It just gets me any of the stress and hardships and things I've got going on. They don't go away. They just don't exist when I'm in the gym. And then whenever I get in my car and drive away, then I can get back to reality. But it helps chip away at it, right? It makes me a better person. And if I'm a better person, the product I can give to my kids and my students is always going to be better. But the trick is managing it. I think people can say they want better mental. I just realized I put mental health. I'm a metalhead. That works out too. Mental health, excuse me. Managing steps though is the trick, right? I think the biggest thing is that the person that hears you the most is you, right? So limit the negative. If you say I can't do this or I can't do that or there's no way that I could ever do that, then you're right. You won't, right? So limit the negative. If you can stop saying things like that out loud, it helps largely with your mental health. And then the next step is I would say is put yourself first. Most of us here are parents, and I think a lot of us have the guilt monkey on our back at all times that, if we do something, the inverse is that we didn't do something. We're not with our kids, we're not with our wives or husbands or etc. And I think you make me the scapegoat. Somebody needs to tell you it is okay. It's okay for you to play that video game. It's okay to go paint. It's okay to do whatever. So you got to put yourself first. And it is selfish, but you have to be. If you're not a little bit selfish for your own health, there's nobody else that's going to go out of their way for you to do it, right? Everybody wants you to be successful. They do, but they're not going to do little things for you to do it, right? They're not going to give you the book to go read. They might gift you a book, but they're not going to check in and make sure you're reading up on chapter 7 and what your thoughts on it were. But you got to take the initiative to be a little selfish, put yourself first, and find that balance. And then hobbies are key. I'm blessed to have too many hobbies sometimes, but I've also got a tremendous supporting cast that lets me chase those avenues down. But you got to have something. Something's got to make you tick. Something's got to be what's Adam Hickson outside of a teacher. What brings me joy and can fill my tank. So if my tank's a little more full from me having a couple hobbies throughout the week or the day or whatever, and then I do put myself first sometimes, I'm going to be way more apt to help other people. And ultimately that's the goal too, right? Is what I can give to others. So next slide, Kevin, if you would, please. So this one is social health. This is probably the one I think that gets swept underneath that blanket the most. When we talk about being healthy, I think your social health is incredibly important. I think too many people in life suffer from loneliness, and not necessarily lonely like they don't. They're not a part of a program per se. They may not have that close foxhole of people that they can rely to. Maybe they got a promotion at work and they don't have that immediate person to text to kind of not brag but share their success with, and that's tough. And I think when people get in those pits, how do you get out of them? And I think one of the best things is finding your communities, and you don't have to necessarily have the commonality already in order to be a part of that. You can just be a part of it. And I get to see that firsthand at the gym all the time. I get people that come in our doors that are not gym minded people. They don't have any background in sports, and whether they want to or not, I've got about 4 or 5 people that are our unofficial liaisons that love on them super hard. We've got a guy named Brian Hutchinson. I hope this gets back to him that I'm throwing him under the bus, but in the first meeting of him, he's going to know your mom's maiden name. He's going to find out stuff about you, and he's just a phenomenal person. And I feel like our gym is full of those kind of people, thankfully. But obviously, the goal is building that community. So then when you go to the gym, you have that sense of community. When the gym does good, you inadvertently are doing good because you're part of it too, right? And we hope where you work at is a community too, but not always. And I get that. And some people don't love eating lunch in the teacher's lounge, and some people don't love being around people. You know, you want to get your space. I get that. That's, you know, I'm here right now too. So, but I think having a community is non-negotiable. You got to have something and someone, and even if it's a close couple friends, if it's a bunch of friends, if it's a group chat, if it's something, you got to have those communities. And then community plural. I don't think limiting yourself to one is a great thing. I think it's okay to be selfish and be a part of multiple things. Maybe your hobby that you enjoy has its own community as well, or maybe you know, you could fill that with whatever, you know, whatever community you want to be a part of, but it's important. It's got to be something you seek out, though. It won't, rarely does it happen by accident. I've never seen too many people have great senses of community by accidents, sometimes, but not often. And then the last thing is setting some boundaries. And this is something that I struggle with. I'm a yes man. I'm excited to help out and be a part of whatever, but you got to be able to set boundaries in life. So never be afraid to protect your peace. If you're a person who likes something that's not the norm, right? Say it's, I don't know, say it's reading comic books and that's seen as nerdy or whatever, and you're shy about saying that, you might be missing out on an entire community or a network or a friend people that would benefit your mental health just because you're afraid of whatever the status quo might be or whatever the norms might be. And that's something we got to get rid of. You got to set your boundaries. You got to protect your peace and never be afraid to tell people no. You know, if they're going to intrude on something that you hold dear, I know most of us that have multiple kids, you get, you know, 30-40 minutes a day to be you and be authentic you. And if something's encroaching on that time, you're probably gonna be an angry person. I know I am, you know. So if I'm in the gym, I got my headphones on and that's my time alone to get my cup full again, and I've got people negative Nancy tell me about the news that I don't watch anyways, get away from me. I protect your peace. I'm going to walk away. I'm going to turn my music up louder, and I need that peace. And you should too. But be confident setting boundaries. And it's tough on that too, because sometimes that's family, right? And that can be a whole other subcategory. But I think without getting my high horse too much, family is subjective. It's obviously you have the ones you're given, but you know your family also can be your community that you choose. So and it's tough sometimes to say no, but you got to find that power within you, because ultimately it's going to bring you back home and improve your overall health. So next slide for me, Kevin, please. So how do you incorporate all three things that I've been saying? You know, I say a lot of cool things, but I think the coolest thing is if they work or if they stick, right? And these are the things I think are the 4 key elements for a successful program. And the program being your health and fitness initiative, right? It has to be some sort of fitness. And I think with fitness, it won't work unless you do is the one I hear often with people in my profession, but enjoy what you do. So people recently in Jerseyville have grown this newfound love for pickleball, and I'm here for it. It's awesome, but it's getting people out and it's getting them moving. You know, it's spring now, so people are out walking. Tremendous. If you like walking and you want to listen to a podcast, that's physical activity. Do your thing, but you got to do something that you know you can earnestly stick to, and then you can't deviate from it. It's got to be something, because the only magic in the fitness industry is consistency. If there was something else that worked, we would know about it, right? There would be a pill, there would be a serum, there'd be something, but the only thing that's known to man that works is consistency. You just got to stay with it. So if you don't like what you're doing, you're not going to do it. You know, we always hear these new fads, these new whatevers, and those people make a ton of money, and good for them. Go make your money, but it's not real, okay? And that segues into nutrition. No person who's truly healthy has bad nutrition, and that's just what it is. You could be friend heavy, live a great life, be the strongest person in the room, but if your nutrition is poor, then the other two will eventually fall at some point. Then all three of these are essentially just levels that we're trying to have on the same level, right? And for nutrition, you know, I'm a 6'3", 315-pound person. So I'm not going to say that I, you know, am beach ready tomorrow. That's not my goal. But I'm goal oriented, right? So my nutrition aligns with that. But your general nutrition, something that I think should be said, is that you have to find what works for you. There is no diet out there. Technically, every diet is calories in, calories out. It's a caloric deficit or it's not. And that's the bottom line. But you can have a lot of play and multiplicity with that, you know, whether that's the carnivore diet, the whatever you find peace in. The real answer is, what can you do to sustain that, right? What are you going to do truly that makes it work? You know, I'm gonna throw a shameless plug. My elite colleague and friend is in the group chat here, and I watched my friend Dylan chow on chicken and rice, and I can tell right now that is a painful, miserable experience for a long haul. And if you're mentally ready for it, you can pull it off. But I'm gonna tell you right now, about 98.9% of people cannot live on what people tell you you have to live on. So the people that say to get fit, you got to do chicken and rice and no carbs and this, that, and the other, most of that stuff is usually monetarily incentivized. If you talk to anybody who's actually in the game, the bottom line is be active, don't eat ridiculous, and find food you actually enjoy that you can, in moderation, not go crazy with. And be very surprised if your lifestyle didn't change because of that. So I don't claim to be a nutritionist, but I would be happy to help anybody with that journey if that's something you want to go down. I've got a great web of people that live in that world. And the best advice I can give is be mindful of nutrition. You don't necessarily have to follow a diet plan. You don't have to track calories, although it does help. You just got to be mindful. I think when people aren't mindful, and that Snickers that's been in the cabinet for a couple of days that hasn't got eaten looks really good, have the restraint to maybe not hammer down, right? The next avenue is mental health supportness. I think if you think you've got all the answers, you're probably in a bad spot. That narcissism only goes so far, and then you have a breakdown. So I think the big thing to know is that it's okay to seek out some mental health support, because life's tough. Stress management is got to be high on your priority list, and that kind of is what I was saying with the previous slide. It's impossible to have that want to better your mental health if you don't have some avenues to do so. So if you don't have a hobby, if you don't have a community, if you don't have a passion of some regard, it's going to be kind of hard to get out of that mental health rut that you might be in, because there's nothing healthy getting you there. So finding a healthy outlet that lets you challenge yourself is good, and then mentally sharpen yourself. But it's also then the support from others. Seek help, ask for it, and find your own peace. I'm bad at my own advice in that regard, because I've always been of the mindset, if you want something done right, do it yourself. But I can confidently say over these past couple of years, we've taken on some more responsibilities. I've got 2 kids, and fortunately, I've got a best wife out there and a mom to them. But I've got a phenomenal support group. The people that are in the foxhole with me are all people that I can reach out to at any given time. And I'm not shy about saying I'm not doing great right now, and they kind of bring me back home, and it's a good refresh resetter. But I have those things because of that community aspect I talked about previously. So I'm definitely taking my own advice, and I think step one is being conscious of your mental health as a fillable cup, right? And if it's low, be real with yourself, and don't be afraid to seek out some people to help you. And then the last thing is lifestyle management. Balance is tough. I keep reiterating the same concept that we all have a lot going on in life, and the tough reality is, I don't say nobody cares. I care, right? A lot of people care, but at the end of the day, whether you get it done or not is mostly managed by yourself. So how do you balance that? It's tough, but not impossible. I think consistency and non-negotiables, kind of like I was saying previously, is things that you refuse to sacrifice, things that you cannot change no matter what, and you got to live and die by those. And I would challenge everyone here to try and think of some things that maybe you leave as, well, it could happen, or it might not happen, or I hope I get to do this, or maybe if it works out. But start doing some non-negotiables and be real with yourself. Excuse me. If we're keeping the theme of fitness alive and working out, it becomes one of your non-negotiables. What are you going to do to make sure that it is a non-negotiable? Am I now a morning person? Am I getting up a little bit before my kids are? Telling my spouse, hey, if the kids get up, I'm not here, ride the wave and figure it out. They got to be able to get your back, hopefully, right? Or maybe if it's reading a book, hey, I'm not going to hide in the bathroom on the floor and act like I'm going to the bathroom. I'm going to just tell you, I'm going to be out in the living room under the light, and I'm going to read, and nobody in this house is going to bother me. And that's what it's going to be, right? But you're going to put your foot down, and that's got to be something that you do. It's non-negotiable, and you got to live by that. And that goes back to what I was saying earlier about being a little selfish. You have to be your own voice and create that lifestyle management, because then everything else can have a platform. Kevin, next thing for me, please. And then this is my last one, right? And I think I've kind of came full circle with it. And I don't think anything I've said is revolutionary. I just want to be your cheerleader, right? I want to be the person that says it's okay to do some of these things, because working out's easy. I think the people that think it's not easy kind of got a picture wrong, and that's okay. I think, sorry, man. It's easy. It's just you need that push, right? So I'm your push. go work out, go be in a community, go be fitness. And I think with the fitness world, it's kind of seen as a cult to where everybody's got six packs and everybody's got their shaker cups and everybody has to squat, bench, deadlift, and be incredibly strong. But I can tell you, as somebody who is in our gym right now, it couldn't be farther from the truth. I'm happy to have those people. I think they all fit niches. If you chase powerlifting down or bodybuilding down, those are all people that are finding their communities, their why, and their mental health support, which is tremendous. And I want to support that. I don't want to take away from that. But I would say for the 85% of the gym, it's people that work 9 to 5s, that got multiple kids, that just want to do it for the right reasons. Maybe they're fighting off, diabetic tendencies, whatever it may be. They've got their own why for being there. And we need to encourage that you don't have to fit a mold to be in a gym setting, right? And I think most people also don't know that everybody is terrified of each other. When you go to a gym, it's intimidating. The hardest thing about a gym by far as a gym owner is getting in the doors. Once you get there, then it's easy. Then you can sigh and realize that everybody there is also super worried that A, people are looking at them, and B, they're doing something wrong. I promise those are the top two things that are limiting factors for people in a gym. And not a shameless plug for JerseyFit. I hope this is Gym X anywhere you are, but that's something I think is encouraging participation, right? Whether that's a group class, whether that's starting small and stuff that you're comfortable with the same machinery over time, cardio, what have you. But start small, encourage participation, and support your friends. If you've got somebody that's in a rut or somebody who's always said they need to maybe start some fitness, or, oh, I really got to start working out, usually it's after Thanksgiving or sometime where there's some food involved. Be the encouragement, right? Be the person that says, you know what, I think you should work out. And I think we should do that. Maybe we can both go for a class, right? It's a stair step domino effect. If you start, it's very hard to stop if you've got other people in your corner. It's very easy if you pull out. And I'm guilty of that too, where I've had a lot of Mondays, and Mondays are your enemy, right? So if I'm going to start this coming Monday, or I'm going to start, whatever, you've already missed the challenge, right? The challenge is you're starting now with whatever. And the now could be, maybe today, instead of fast food, I'm going to eat the leftovers I said I was going to eat. Or maybe instead of the soda, I'm going to drink a water, right? And then because you started that journey, it's way easier to encourage other people. So if you're both on the same level and you go, I found that to be the case. And I've got a community of that now at the gym, to where if I'm not there in the mornings, I get about 4 or 5 texts. They'll say, oh, it must be nice to sleep in, or I wish I had what you have. They're just busting me a little bit, and that's healthy, but that wouldn't have started if we didn't originally encourage that participation. And I'm extremely thankful for that. So the last slide is simply just my contact information. I appreciate being here. And I hope, if nothing else, the big thing I want to try and convey is that your health is a big, broad term. The health is way more than just the weights and your regulation of nutrition. It's all the stuff that comes with it, like your mental health, especially your social health, and then obviously some physical health always helps out for a lot of reasons. My contact info is on the screen. I'm super easy to find. I'm all of our social media for Jersey Fit Barbell. I'm here at Jerseyville High School as a strength conditioning coach and PE teacher. And I'm as authentically transparent as I can get. If you want to talk classic rock, I'm here for you. If you want to talk how to be better in the gym, I got you. And then, if there's anything school related I can ever be of service for, please, I'm your guy. Make me somebody that's the start for your community that we're talking about. So it only takes one. Obviously the more the better. But if I can be that first person, to get you stepping towards any one of those health pillars we talked about, I'd be happy to be that guy.
Adam, that is awesome. Thank you so much. Ladies and gentlemen, questions for Adam this morning?
No question's a bad question. I'd be happy to anything.
I will say, Adam, a couple of years ago, you ran a promotion. I think you were for teachers during Teacher Appreciation
Yeah.
Week. You extended it to the month of May, and so that brought me through the doors. And the Wellness Center in Jerseyville is closer to our home, but our youngest son is 9, and you have to be 10 to even walk through the door at the Wellness Center unless you're going to use the pool. And again, not throwing shade on the Wellness Center, but just to say, we then texted Adam, and he's like, I want your kids in here. I want them learning how to work out. I want them learning cardio. I want them getting into this, as they go along, obviously supervised by me and my wife. But I just thought that was super cool, and obviously have known Adam from around town and through friends and colleagues and all of that. But JerseyFit is my therapy, man, and it's been awesome. I know not just for me, but for our family as well. So definitely throwing that out there. And guys and girls, if you are in the Jerseyville area, by all means, it's worth checking out. You get Adam said shameless plug, and I'll give you a shameless plug too. But it's got an excellent culture, and really, you got Adam there who can work with you on training. And Nick, obviously, I saw his arm injury. We were there on Sunday, I
Yeah.
think, and that was a rough one for him. But I know he'll be around too. So,
Yep.
and Adam, the points that you brought about all of that being in balance. My Uncle Bobby is my closest relative to me in Chicago, and he's been talking to me about balance since I was a little kid. But
Yep.
it wasn't like you said, you force yourself to come to a point where it's like, yeah, I have to be a little bit selfish. I have to put me in a spot because you can't pour from an empty cup. We hear that all the time, and that's very true.
Yep. Absolutely, man.
Awesome. Folks, questions for Adam? I will share your slides, Adam, and also your contact info and stuff. The email goes out. We've got 500 members. The email goes out to everybody. So I'm hopeful. Hopefully, you get some texts and some calls.
Perfect, man. Thank you for your time, guys. I appreciate you.
Appreciate you, Adam. Thank you so much. Folks, I am going to turn over then to Meaghan Jorgensen. Meaghan, I'm making you a co-host,
Cool.
and turn over to you. Welcome. I'll let you do your intro and show us what you got.
Is it working?
I can see it.
Perfect. Cool. Okay, I'm gonna talk fast. Just because I feel like people do have a lot of questions at the end, so I just want to make sure I get through everything. So I might skip a few slides. But my name is Meaghan Jorgensen. I'm Director of Operations for the Children's Behavioral Health Transformation Initiative, technically out of the governor's office. So I'm going to touch a little bit on our larger transformation initiative, but primarily the focus is going to be on Beacon, which hopefully after this presentation you guys will utilize. I'm going to play a short video that gives a little background on Beacon. This video is available on YouTube. It's just a Beacon introduction video by my boss, who is the chief of the Children's Behavioral Health Transformation Initiative. Feel free to share this, send this, but it's a great introduction so families understand about Beacon. If you cannot hear this for whatever reason, let me know and we'll just skip it. Good.
I'm Dana Weiner, Chief Officer for Children's Behavioral Health Transformation in the Office of Governor J.B. Pritzker. I'm excited to tell you about a new tool that can help find services for youth who are struggling with mental and behavioral health challenges. In 2022 and 2023, the Children's Behavioral Health Transformation Team heard from many families about the difficulties they face while looking for mental health services, such as counseling, hospital, and residential services. They told us it was very challenging to find what they needed and to understand what state programs their children might be eligible for. We heard them and have been working on solutions. In collaboration with the Illinois Department of Human Services and Google, we've built a tool that can help. The new Beacon Care Portal will provide parents with a single place to look for services, information, and help for their families. Beacon will connect parents and guardians to dedicated full-time staff who can help explain the process of qualifying for and receiving services through state and local programs. Families can create accounts to upload important documents, such as individualized education plans, consent forms, and previous assessments. This will streamline access to support. Beacon will also help Illinois state agencies that serve youth to work together more effectively, which has been a key barrier to delivering timely care. All of these improvements will deliver faster responses to requests and will cut down on time spent searching for the right services. The information that families put into Beacon will be private, secure, and encrypted so that only the child's guardians and those they give permission to can see it. We know there is still more to be done to fix our system, and we are hard at work on other changes. These include making sure there are enough spots for everyone who needs help, shortening waiting lists, and removing any barriers between kids and what they need to be healthy, happy, and strong. Beacon is a great first step. We hope you'll help us spread the word and give it a try.
Okay. Okay, so like I said, this larger initiative was established out of the governor's office in 2022. And basically, the overarching philosophy is we're going to focus on closing the gaps in behavioral health services across the state of Illinois and bring together all the child serving agencies in one room all the time to connect and try and help problem solve. So Beacon is just one core component of this larger initiative and a single website that connects families to people, programs, and services. So I'm going to assume that most of you are familiar with the state of Illinois and how youth mental and behavioral health services are divided, but they are fragmented into 6 different child serving agencies. Not all states are structured like this, so it creates a little bit of silos within this larger service array. So we have DCFS, which is the Child State Welfare Agency. We have DHS, which actually holds Beacon. There's a whole division of mental health and recovery along with developmental disabilities. We also have Department of Juvenile Justice, the Department of Public Health, the State Board of Education, and then of course HFS. So we partner with all of those agencies, and they are part of the larger interagency group that manages Beacon and all the youth that are entered into the portal. So all of our goals fit in these buckets across the Children's Behavioral Health Transformation Initiative. We want to adjust capacity, make sure there's enough services that we need, streamline process, make it easier. Half the time, the people at the state don't even understand all the pathways and all the different processes. So let's just make that easily accessible to families. Intervene earlier. Let's get to kids before the crisis. So we can prevent them. Increase accountability. We want to be transparent. We want to be very open about the availability we have, the services we have, and the length of time it would take to get those. And then develop agility. We need to be responsive to the changing needs of the youth population. Obviously, right now, and especially after COVID, we have seen a drastic increase in the acuity of mental and behavioral health concerns with youth in the state of Illinois. So these are the 12 recommendations that come out of a master document called the Blueprint, which my wonderful boss, who you saw in that first video, Dana Weiner, put together. These are the 12 things we have to do to begin right-sizing the state of Illinois. I will not go through all of these, but number 1 is Beacon, and that also happens to be the first thing that we built. So inefficiency is trauma, and that's also another thing that we really focus on, right? It's the forced delays that the families have to deal with, the prolonged crisis management. It just creates more deep-rooted trauma. For the child, continually hearing declines or exclusions or the waiting time to get in to keep being extended when, they're saying they're ready for help, but we can't get it just yet. So we just want to build a system that sees and supports the complexity of child and youth service needs, speeds up delivery, and mitigates movement down the crisis continuum. This is a graphic that we drew up very early on in the process, and I think it really illustrates very well what families see, right? When they're seeking services, mental and behavioral health through the state of Illinois, you're going to enter through one of those pathways, right? And so if you enter through DCFS, you may only hear about one program that you might be eligible for. If you enter through DHS, you may only hear about 2 programs that you couldn't be eligible for. In reality, there's many more. So what we have now is something that looks like this. You can enter through any one of the 6 child serving agencies and immediately get referred to Beacon, who will then assess every state program and every local resource and make recommendations to the family. I'll just also add, this is a good time. This is the first of its kind across the entire country. No one else has anything like this. I actually was meeting with Utah yesterday, and they were just like, how did you do this? How did you do the consent? Were you able to get all the statutes in to make this possible? So there are lots of people that are very interested in this, and this is a very groundbreaking system that we developed. So the goal was easy to follow directions, in a sense, a trail map to help families along the way, and then a live human who will be coordinating behind the scenes with all the state agencies and system partners to kind of take that burden off the family. So I want to be very clear on this, because sometimes people call Beacon a program. Beacon's not a program, right? It's a routing application. It's a resource and referral tool. We connect the family to the right services through a single website based on needs, characteristics. We built this eligibility algorithm behind the scenes. So based on the information families enter, we tell you all the programs you could be eligible for. Then we will coordinate with all the state agencies to make sure that all the documents are in one place, everyone has all the same information, and that we're pursuing every avenue for services at the exact same time. That's super important. Families do have the ability to create an account. When we were kind of on our listening tour about building this, that was one thing we really heard, is that parents wanted one single place to upload all their documents, right? Hospital records, psychological, IM cans. So they can do that. No one else can create an account. So again, I just keep hammering this home, like Beacon is just one piece of this much larger puzzle that we're working on. A few other things that will be coming very, very soon. Right now, our community-based resource finder is Spider. And if you've ever worked with Spider, you don't like it. And that's okay. We all know that. We're very aware of that. We are in the process of procuring a new statewide resource and referral tool. HFS is working on us with that. And we want it to be like Open Table. Like we want it to be beautiful, find everything, maybe make appointments for people. So we're dreaming really big. And as soon as we have that done, which I'm hoping will be in the next year and a half, we will link that tool back to Beacon and get rid of Spider. If you are ever searching Spider and you can't find a program and you're like, I know that exists, Brittany, can you put my email in the chat while we're on? You can always email me and I can get you connected, get the provider connected with the Spider team, and they can manually enter. That's why Spider is so difficult, is it's all manual entry by people, but that's what we use right now. We also have been given a great deal of resources from the governor's office in regard to expanding capacity. We know that exists, and we are working tirelessly to actually figure out the right things to build out. And that's what Beacon gives us, is a great data set and data tool to know what are the most diagnosed issues in the state of Illinois. What are the facilities that are declining them? Why are they getting declined? And I would obviously say aggression is the number one reason kids will get declined. So just really focusing more on what we're developing and how we are ensuring that those places don't exclude the kids that actually need the treatment. So we also, I don't know if people are familiar with the lands that used to exist in Illinois. If you've been in this area for, I see people shaking their head. We also heard that from people that they really want the lands to come back. So through IDPH, we are reworking on fortifying community networks. We actually just awarded 7 different community networks. So their real responsibility is going to be within the community, making sure all the resources are brought together, everyone's aware, all of those things. So we have a lot going on. Beacon went live to the public about a year ago. This data goes back to January, but in the first year alone, which still blows my mind, we have had 34,622 unique visitors to Beacon. And roughly 1,400 kids entered into Beacon. And I will explain what that means a few slides down. This is what I'm talking about. We were talking about with Utah. I'm a lawyer. I don't work as a lawyer for the state, but myself and 12 lawyers from the state of Illinois put together this consent. So once we have this consent signed by the youth, family, and a witness, all of us can share any information related to treatment and services for any mental or behavioral health thing that the family is looking for. So that's been super pivotal and has made things much easier. I won't go too much in depth this, but we can totally tell, like, when this email gets sent out, if we get like a huge uptick, because I know you guys said you had 500 members of the group, we might be able to say, oh, we gave a presentation today, but we track daily where users are coming from, where the site comes in. It's actually really cool. So who is Beacon for? Beacon is for any youth in the state of Illinois, regardless of insurance. We will find a service for private insurance, Medicaid, no insurance, undocumented. We will find something. It is for any youth, regardless of the mental or behavioral health diagnosis. But I caveat that the youth should have some mental or behavioral health concern. We've already been asked by everyone in the world, can you expand beyond that? Can you do this for adults? We're not there yet, but we recognize that like the need for something like this expands just beyond youth mental and behavioral health. It's best for ages 5 to 20, and I say best for a few reasons. Some youth state programs, if a child is enrolled before their 18th birthday, those programs can extend up until age 22. But if they're not enrolled before they're 18, they are not eligible for any youth program. So when I say 18 is the cap, if you know that there's a child who's older than that, and I saying child, but you all know what I mean. We're still our parents' children all the time. But so any youth that is that over the age of 18 and already enrolled in a program, we can help. Any person can use Beacon. They can search for themselves, which I will say we haven't had a youth do that yet. Parent, guardian, caregiver, any provider, anyone can use Beacon. So what Beacon does, just again, community connects families with community-based services through Spider, which will be replaced shortly, connects families with all state-funded programs, and then provides live human service coordination behind the scenes that will really take a lot of pressure off the families. So Beacon is also available. This is what the homepage looks like. Beacon is available in 7 different languages, and it's really nice. It auto-populates, and the consent auto-populates in whatever language you select the family might need. Website is beacon.illinois.gov. Just a reminder, only parents can create accounts. And then on the homepage, we have tons and tons of all the state crisis resources. And I want to be very clear, it's not a crisis resource. It is, it's not an emergency resource. So if a parent wants to create an account, they select parent or guardian login, and they follow this very simple process that's illustrated on the right. If it is not a parent or guardian, or even a parent or guardian doesn't want to create an account, you just press that get started button right there on the bottom in blue. Once you enter some preliminary information, you're going to get 2 lists back, right? You're going to list a state-based program and community-based programs. You can email these lists, you can print them, you can save them. We also, and this is new because we have this designated IT team that's wonderful and constantly making improvements for us. We can now see the list that is generated. So we'll have the same list that you have before you guys got the list, and then we were just coming up with the things in our head. So that's pretty cool. But so even if a family doesn't want to interact with Beacon, right, and just you are like, okay, this family needs help, but they don't seem like they're ready for it, you can go ahead here and you can put in like John Smith, right? But the zip code has to be correct, and the presenting problems have to be correct, and just get resources without giving us the full name if people feel more comfortable with that. So this is just a little screenshot of what it looks like. These are the types of questions it's going to ask you: age, name, address, zip code. What are the following needs? Who has legal custody? That's very important because that determines what program someone may be eligible for. I will say this: Beacon is not for youth in care. Sometimes a youth in care gets put in and we have a whole process for that. But if that's the case, if you're working with a family who happens to be youth in care, you can connect with me and I can connect you to the right people, but it's not specifically for that because they have their own streamlined, own specific services. What service are they currently receiving? Who are they currently involved with? Insurance, This is the most important screen I'm going to show you this entire presentation. After you enter some preliminary information, it's going to ask you, do you need further assistance? The only way you're going to hear from our team is if you select yes. And this was very purposeful so that people could just go and grab resources and not have to interact if they didn't want to. So the 1,400 cases as of January were just the cases that said, yes, we want further assistance, if that makes sense. So lots of people use Beacon, but don't necessarily always want the full spectrum of services. So you hit yes. So just to recap, your list of services will be on the left. Do you need more assistance? Yes, if you want it. And if you did this all correctly, it's going to give you an email that's going to say you'll hear from someone at DHS within 24 hours. I'll be honest, we're really quick. If you enter a case between the hours of 7 a.m. and 2, you're going to get a call back probably within an hour. So answer the phone because we work with you to get things moving. I'll also say, and sorry, I'm trying to talk fast, and I'm very sick, so I apologize for the nasalness, but I think cases, it's kind of a catch-22 because we really want to empower parents and families to be the person who is taking on, like empower them to take this on and know that Beacon will be very helpful. Sometimes if a case comes in through a provider or someone from the state that's working from the family, we get a much better picture of everything that's going on. Only because if you're a state employee or a service provider, you're more likely to understand all the people and where they come in, right? So a lot of times when we talk to parents for the first time, they're like, well, there's a caseworker from here. I'm not really sure what they do. And then there's this other number calling me and I don't know who they are. And they keep saying, so sometimes it paints a better picture when you're familiar with the system. But we appreciate either that gets entered. So we have a team of 3 resource coordinators. It's soon to be 4. They are the first people that interact with families. They collect basic information and they keep any case that needs community-based resource. If at any point the case becomes more complex or the family or youth is looking for a residential setting, it goes to a clinical specialist. So licensed clinicians, we are also soon to have 6, where we just keep expanding. Then the clinical specialists are broken up into the 5 categories on the left, very purposefully so that they can know those disorders, know that system. We are the 6th clinical specialist we are adding is going to be another neurodevelopmental disorders because that is our highest case volume, which I think we also, we've seen an increase in that space as well. Okay, so again, recap. Anyone can enter a case into Beacon on behalf of a family. Provider who entered will receive a confirmation email and you'll receive a call back from a resource coordinator within 24 hours. I'm going to read this super quickly, but this kind of gives you a good overview. Amelia is a 14-year-old diagnosed with ADHD, depression, and anxiety. Amelia was hospitalized after a suicide attempt and had been implicated for aggression towards a younger sibling. The hospital social worker entered Amelia's information to the portal to assist the family with finding residential treatment after discharge, as her grandparents felt they could not take her home because of concerns about her behavior. Prior to entering into Beacon, this family had not been connected to support services. A Beacon clinical specialist worked with the family to enroll Amelia in Pathways, FSP, interim relief, as well as completed IM CANS. The FSP program successfully found a residential placement for the youth, and she was discharged from the hospital to the placement. What makes me the most frustrated is when we get cases where there's youth who've been hospitalized 6, 7, 8, 9, 10 times, and they haven't been connected to any of these programs, right? They're not enrolled. We don't have a psychological. To get into any residential treatment in the state of Illinois, you're going to need a psychological, you're going to need an IM CANS, and quite frankly, you may need something in an IEP that designates the type of placement for education. So those are the 3 things that actually really slow down placement because we get a lot of youth in the portal that who have been hospitalized so many times, but have not gotten these basic things done to evaluate what else is going on. So that's my big plug there. I'm just going to skip over this. We have a whole Children's Behavioral Health Transformation Initiative website that lives at DHS. But on that website, we have beacon flyers, the consent. We have a version of this presentation that I just gave related to school personnel. We are in the process of creating with the Illinois Hospital Association um, a presentation that is primarily targeted at hospitals and what they can expect from Beacon and how to utilize Beacon. So we're constantly trying to educate and build. I mentioned this before, but we built Beacon in about 8 months, and the only way that was possible is because we partnered with Google, and Google built it for us. So since Google built it for us, we have our own IT team now at the state of Illinois, and we are constantly bi-weekly updating and improving. There's an email at the bottom of Beacon. I forget what it is off the top of my head because the acronyms are just too much sometimes, but it's like DBH at DHS. That comes directly to a mailbox managed by our team. We love feedback. We love suggestions. We love to hear from people who've utilized Beacon. If you have questions when you're using it, you can email there. We also, this large QR code is if you want to scan and get on our mailing list, newsletter updates as best we can. I will just note we haven't been the best lately because the person who did all that was on maternity leave, but she's back now. And if you ever feel like diving into some heavy reading, but very good reading to understand where we started on a statewide basis, that small QR link is to the blueprint, but I will caution you, it's 90 some pages, but it's very good to understand why we're at where we're at. So yeah, I'll take questions.
Meaghan.
Yes.
Hi, I'm Rita.
Hi.
I'm glad I set in on this because I'm not a social worker. I do drug prevention education.
Awesome.
However, just it's a good resource that I can use.
Yes, you can.
I do get contacted and ask about there was a situation here before Christmas. You had mentioned that typically it's the parents or the guardians that see to this. What about a child, 15, 16-year-old that the family situation, she doesn't want to share something because she knows, and I know the family situation. Would this be something that they could even at 15, 16 sign themselves up?
Well, I will tell you this. I've never had that happen yet, which is actually surprising, right?
Mhm.
I would say yes, but if that's going to happen, I would love for you to like flag it for me on the back end
Okay.
so that I would be aware and make sure it's very well communicated, that it's only the youth that we should be talking
Okay.
about.
Okay.
Because I've not had that happen. Because usually
Right.
right when and I want to get to a point where every case we're getting is not a crisis. Do you know what I'm saying? Usually when it's a crisis, the
Right.
parents are pretty still involved, but we do get quite a few kids that don't want to return home.
Mm-hmm.
So we work
That
with
would, yes.
yeah, we work with a lot of that.
Yeah. Okay. All right. Thank you.
Sure. Anybody else? I love questions. Usually I save like a half hour for questions. So like really I love questions because I think it helps. But so I'm happy to take any.
Meaghan, you had said something in there about the Illinois mental health workforce development, and I've been hearing a lot about that. Can you talk just a little bit more about that and kind of what direction that's going at this time?
Yeah, so I am not like there's 12 recommendations and I don't sit on that recommendation, but we've been trying to just do like some pilot programs that expand services and opportunities. Our first one, and unfortunately, I'm not sure we're up in the air about if it's going to continue or not, but we tried to develop a pilot program for in-home behavioral health support aids for families of youth diagnosed with autism. Again, because that's the major thing we heard. But in the process of developing that, and now ABA has been much more widely covered through Medicaid. But so trying to do things like that, and we're open to anything. Like if people are like, we think we really need this, or we think we need to get more opportunities, we're open to any of that. But I can get you more information. There's a specific work group that's on workforce expansion that I haven't checked in with in a while, so I can get you more information on that if you're interested.
That would be awesome. I love to hear about the in-home services. And that honestly, the workforce expansion and retention was kind of part of what started this group in 2018, just because pre-COVID and then during and after COVID was kind of, we call it the great exodus in mental health. I mean, a lot of people, whether schools, community, or whatever, just came to a point where they weren't. So a lot of what we're trying to do is that retention. So I'm excited to recognize this, excited that Spider is going away, but that it's being replaced obviously by something better. And cool that your team is so open to suggestion and feedback too, because that's, I think a lot of people think, oh, it's, a state initiative versus now we've got reps from the state saying, please give us feedback. Please tell us how this works so we can improve it for everybody. That's super cool.
Thank you. Thank you. Anybody else? And I think Brittany put my email in the chat. I am happy, like if you guys have questions or like have a case that you think or just anything, you can always reach out and email me. I usually respond pretty quickly. So I appreciate you guys having me. Oh, yes.
I am a youth resource advocate with Illinois Coalition. Are there any downloadable or printable resources to distribute to?
Yeah, so if you go to our Children's Behavioral Health Transformation Initiative website, so
Okay.
just Google because all the websites coded to state, like the email, I can't be like, it's a DHS dot blah, blah. It doesn't work like that. So just Google Children's Behavioral Health Transformation Initiative website, and it'll take you to our homepage. And there's tons of documents, things you can hand out. We have some providers who, everyone here is familiar with CCBYS, right? No, CCBYS is the agency at or not the agency, the program at DHS that works with family reunification. Like if there's a lockout or a child gets left at the police department, they actually, some of them just do the consent and the flyer, like in all of our initial paperwork with the family. So you can take any of that. We love for the information to be shared and utilize it when and wherever you would like.
Okay, great. Thanks.
No problem. Okay. Well, I appreciate everyone for listening. I know sometimes these can be dry and long, so reach out if you need anything, and thank you for having me.
Meaghan, thank you so much. And I will, again, 500 in the network, and we had, I think, 23 on the call today at various times. So I think
great.
as I send this out to the group, you will have plenty more feedback questions and all of that. So, and then I will, I saw where you had the presentation and stuff on the DHS website. So I'll throw that on there too, just so people can see the slides and all of that stuff. So
Awesome.
very cool.
Thanks so much. Have a great day.
Much appreciated. Thank you. Thank you. And thanks, Brittany, too. Anybody else? Anything else for the good of the group? Last thing I want to throw out there, and I will also send this out. Super excited. Next month, March 19th, we are going to be in person here in Gillespie. We're going to try something brand new. It's called Counselors Change Up. And we're going to have a series of topics, and two of us are going to sit across from each other. And so if your topic is a student drops, a bombshell on you about self-injury or suicidal ideation or something, that's your topic. So one person acts as the student, the other person acts as the therapist, and then you flip roles after 3 minutes. So you get kind of the therapist's best 3 minutes on that particular topic and asking questions and engaging and all of that. Then you flip-flop. Because I know exactly how I do this, but I haven't had the opportunity to see a lot of the rest of us do this. And I think it would really be a positive and be cool to get people together in person and all of that. We're going to have some refreshments, I promise. So looking forward to that. I'll send out an official invite and all of that, but just wanted to plug that and let people know it's 1 to 3 p.m. here in Gillespie on the 19th of March, it'll be the third Thursday of that month. Anything else for today before we sign off? I appreciate everybody. Thank you so much, and we'll see you next time. Cheers.